Oh no, I've never seen this comment before. Certainly not on my page 400,000 other times. But let's talk about it again. Let's talk about heavy metals in breast implants. Are they causing symptoms? And do heavy metals around implants mean you should take the capsules out when removing implants? So lucky for you, they actually looked at this in a great study that was published 3 years ago. They looked at patients with breast implant illness, symptoms, and breast implants. They looked at patients with breast implants and no symptoms, and they also looked at a group of women having breast surgery that didn't have any history of implants and weren't having implants placed. In this study, they looked at capsule tissue from the two populations of patients with implants, and they also compared it to breast tissue because, of course, they don't have capsules, they don't have implants, and they looked at this tissue in regards to heavy metal levels, and they compared that, and what they found was there was no difference. There was no difference in heavy metal levels in capsule tissue of women with symptoms, women without symptoms, or women who have never had implants. So what does this mean? This means that heavy metals are not a reason to remove capsules because there are in fact no differences in heavy metal levels from women with implants and without. So let's talk about the next two things you write in this comment. Number one, I should be talking to the doctors that do this all day, every day, and that the evidence is the women who have had their implants out. So let's start with the second point. So anecdotes aren't evidence, and it's really important to have good evidence-based care. Women deserve that. Women with BII deserve that. So we know from multiple studies in multiple countries now that implant removal is what helped women's symptoms get better. So yes, women who had their implants taken out in all different sorts of ways get better at the same rates. So those women who had their implants out did get better, but what the studies show us is how they come out doesn't matter. And why should that be important to you? That should be important to you because women have higher complication rates and worse outcomes when their implants are taken out in a way that includes removing the capsule. So if you care about these women, you care about them having the right surgery, and the right surgery doesn't involve capsule removal. And then to your middle point, no, I have no interest in talking to doctors who don't practice evidence-based care, who don't know information that was published multiple years ago. Why would I care what they think? So instead of trolling the internet and harassing good surgeons performing evidence-based care for patients, why don't you go to these great doctors you want me to talk to and ask them why they're ignoring this study? Ask them why they're still recommending capsule removal when it's been shown in multiple studies to not be needed to improve patient symptoms. Start holding them to a higher standard instead of harassing me.